Irritable bowel syndrome. It is the functional disorder of the bowel movements, that is, the peristalsis waves which are produced by the stimulation of the sensory fibers in the mucosa of the intestine. Normally, these impulses passes upwards into the central nervous system, and from that orders are transmitted to the smooth muscles of the gut. They produce the movements necessary, which are essential and they are normal in intensity to drive the excreta or the waste product of the intestine outward through the anus. So this is the normal reflex function. But in this disease, this function is disturbed, and the intensity and the power of the waves or movements varies from hypotensive to the feeble category. When it is feeble in intensity, it produces constipation. When it is faster and quicker movements, they produce diarrhea. So this disorder is a combination of the symptoms and signs, due to which it is called as syndrome. So in this syndrome, there is alternate constipation and diarrhea, which start as acute phase and passes on into the chronic stage. So it is a lifelong disorder. There are pauses of normalcy or the normal phase when the movements are at the normal intensity and the stool is normal one. So it is divided into three types: IBS diarrhea, IBS constipation, IBS mixed one. So it is a absolutely disorder of the waves produced within the gut to drive the excreta or waste products outward. There is no pathology, no inflammation, no laceration, no any organic disease or the disturbance in the walls or the lumen of the intestine, whether it is small or large one. Now, there are trigger factors which produces visceral hypersensitivity in the mucosa, that produces abnormal impulses which are conveyed upwards into the central nervous system. These are the factors. It is the etiology of this disorder is unknown, but it is said it is produced under the age of 50 years, mostly in the females due to the action of the estrogen. There is familial predisposition, the genetic disorder. Then there is also, it is produced by the food allergy, especially the fructose, lactose, and gluten food allergy, which produces irritation and the stimulus to produce the abnormal waves, which produces changes in the frequency and the consistency of the stool. So the various signs and symptoms, they are divided or the ruled under the Rome formula. There is lower abdominal pain, which is relieved by defecation or evacuation of the waste or the feces. Then the pain appears at least once weekly for the next 3 months. There is change in the consistency of the stool. There is change in the frequency of the stool. So these are the criteria are the main points to differentiate it from the other, the pathologies of the gut. So it is a different disorder from the other inflammatory diseases of the intestine. Moreover, if there is gastrointestinal infection that may produce later on this disorder, that is the irritable bowel syndrome. So these are the basic things which are said to be responsible for the production of this IBS. So it is the disorder of the bowel movements or the abnormal peristaltic movements which varies in intensity and produces alternate diarrhea and constipation.